Hey, Dr. Birchler from Chiro Health Spine and Disc Center. I want to take a few minutes to review a recent study and kind of take a loosely organized conversation here. I get asked things on a day-to-day basis. People have different things going on, and it's kind of like, what do you think about this? They'll ask me, what do you think about taking this medication? What do you think about this or that? And they're important things. And sometimes, the way I would think or what I would do is very, very different than the other information getting in the medical system and things. So, with that being said, let's just dive into a little information here. Make this relatively quick, but for anybody out there dealing with neuropathy, nerve pain, anybody taking things like Gabapentin, Lyrica, things for for neuropathies or nerve pains or chronic pain, this would be very relevant, to you. So this is a recent study, 2025, talking about the increased risk of dementia and cognitive impairment for people taking Gabapentin, which is commonly prescribed for nerve pain or neuralgia or neuropathy or things like that. And basically what they're saying is they have a large sample size, and they're trying to weed out other factors and just saying, hey, prescriptions of these medications is associated with increased risk of dementia and cognitive impairment. Okay. And it's like, wow, what does that mean? It means it's not good for you. So sometimes people ask things like, well, what do you think about doing that? And the answer is no, I wouldn't do that. Doesn't mean I'm not compassionate to pain, doesn't mean I don't believe they're having pain and those kind of things there, but you take these things and there's always a consequence. These things, medications, they're not vitamins, they're not good for you. They're just some kind of chemical treatment in it's not natural, and there's always a negative to that. So my answer is basically no, I wouldn't do that. But sometimes it takes, if you don't have that philosophy of life, you got to look at these kind of things and say, oh well, yeah, it's been shown to have this problem, and maybe that's an evidence for people not to take it if you philosophically are not kind of so inclined to just not do those kind of things. So that's one thing. So just be aware of that. I would say in practice, as I see people on various medications, and the more medications they're on, I would definitely say that I see an association between cognitive issues and medication use, kind of period. And there are definitely ones like cholesterol medication, which certainly tie into that as well. That's another topic, but here's another one showing this. So why would somebody be prescribed this in the first place? Well, basically pain, and in particular nerve pain. So brand names of Gabapentin, Neurontin, Grayless, Horizont, and they're for things, nerve pain, neuralgia, restless leg syndrome, nerve pain. All right. These things are generally real physical problems that people have. I see this prescribed probably most commonly for things like neuropathy diagnosis. And we commonly see these neuropathy diagnoses with degenerative disc issues in the very bottom of the spine, where the nerves come out and go to the legs and the feet. And so when people have degenerative disc disease, the space around the nerves starts to thin out, and then you get these pain, numbness, tingling, hypersensitivity, neuropathy type of things in the legs and feet. But it's actually a physical cause to that. It's not like some diabetic neuropathy or something else. It's a physical cause to the neuropathy. So then taking these medications is just a treatment, and they're not good for you, and then they cause these other problems, all the while never addressing the physical problem. And so I wanted to get into the background here of why people commonly take these things, and really what the root physical cause of these problems is for a lot of people. So let me show you something here. This is a study where researchers were basically stimulating invasively into the body, into the discs in the low back, and looking at the the pattern of pain produced by a disc. Now this is not pinched nerve pain when a disc blows out and hits the nerve like sciatica. This is just the disc itself, with the understanding if the disc has a tear in it called a fissure, if the disc is degenerated, the disc itself can produce these pain patterns. And long story short is a problem exactly in the low back and the lower spine here, can produce pain in the back and hips. Can even go to, say, the thighs or the groin. I've seen that in a lot of people. It can go down into the thighs, and it can go down into the legs and the feet. And basically the rule of thumb is the more severe or intense the problem or the stimulation, the further it emanates out from the center of the body. Kind of like, I don't know, the more intense the fire, the higher the flame rises or something like that. So by the time somebody has a degenerative disc in their spine and they're getting these neuropathy pains in the legs and the feet, there's a big problem down there, and they're getting symptoms radiating all the way out to the legs and the feet. You go to the doctor, medical world, and hey, you have neuropathy, and they give you the medication, never really evaluating why you have that, and is there a physical cause, and is there mechanical treatments or things to get better from that. In terms of what things look like, this is just a simple X-ray of a severe degenerative disc in the back, and this area here is healthy. You have a bone and a bone, and there's a nerve that would take up part of this little keyhole-looking space here, and that's normal. These ones look fairly normal. Now down here, there's a nerve coming out of here, but because the disc is thinning and you can't see on X-ray, the disc is bulging, there could be other things going on, the nerve coming out of here is likely having some level of mechanical compression, tension, and on MRIs you can actually see the nerve in there, and you can see maybe if it's flattened or squished or things like that. Now the nerves that come out of there go down into the legs and feet, and so it can actually be the physical cause of these neuropathy type of issues there. So I'm putting this out there to say, with the type of things we do here, a lot of times people that are having nerve pain, restless leg nerve pain, neuropathy, issues in their legs and feet, nerve pain, chronic back pain, there's underlying, degenerative issues, disc bulge issues. There's real physical things happening in the body, and those things need to be addressed to actually really get a result. And these other kind of medication things, there's dangers, there's side effects. It doesn't address the underlying problem, and it's just a train wreck, one of many train wrecks that happen when you, instead of looking at physical issues and addressing them, you just throw unnatural chemicals at a physical problem. So I hope that this helps somebody out there, maybe somebody dealing with this. I know we have a lot of patients dealing with this kind of thing. If you have questions about this in your particular scenario, you can ask me, but you basically got my answer, which is, let's make sure that we are addressing and properly evaluating why you're having that issue. If somebody's recommended you take that, or maybe you've taken them in the past, or wonder, should I keep taking those given what we know is those issues are causing. So hope this helps.